Man, if you're over 60 and you truly care about taking care of your penis health, you need to pay attention right now. This video was made for you. Many men avoid talking about this topic out of embarrassment or simple negligence, but they end up paying a heavy price. What I'm about to tell you here isn't a minor detail. It's a serious warning. It's about your life. When we talk about penile health, we're not dealing with whims or mere vanity. These are essential cares that determine your well-being, your quality of life, and even your longevity. It's something that, if neglected, can lead to severe and irreversible effects. I'm Dr. Silvia Morales, a urologist, and I've already treated countless men who came to the consultation too late. Most of them didn't realize that small habits were gradually destroying the health of their penis. What I'm going to show you now can save you a lot of pain. These mistakes may seem simple, but they're not. They accumulate over the years, wear down your body, and turn your intimate life into a constant challenge. Every year, I meet more men who regret not heeding these warnings when they still had time to change. That's why, in this video, I'll detail the 10 most dangerous mistakes that a man over 60 should never make with his penis. Some you might already be doing without noticing. Others might sound strange, but they all trap your intimacy. Stick around until the end because mistake number 10 is the most critical. Few people know about it, and ignoring it leads to severe damage. If you truly value the health of your penis, don't close this video. The first mistake you should never allow is ignoring signals from your penis. Many men notice subtle changes and think it's just part of aging, but the body always warns you if something's wrong. If you ignore this, you're heading towards serious problems. The penis doesn't lie. Changes in color, minor discomforts, alterations in sensitivity, or even difficulty urinating are clear alarms. And the sooner you address those signals, the easier it is to treat the problem. Dismissing them is like letting a spark turn into a devastating fire. I treated men like Don Miguel, 68 years old, who ignored a sore on his penis for over a year. He thought it was just temporary irritation. When he finally sought help, we found something much more serious. If he had taken care of it earlier, he could have avoided so much suffering. No one likes the idea of showing their penis in a consultation. I understand that embarrassment well, but worse than that is missing the chance to treat something early on when it still has a remedy. The embarrassment passes quickly, but the consequences can last forever. If you neglect what's happening with your penis, you're not just ignoring a discomfort, you're opening the door to ills that progress hidden away. Many times, by the time real pain arrives, the situation is already hard to reverse. That's why my first advice is clear and firm. Don't ignore your penis. Look at it, touch it, check it, pay attention. It's a central part of your health and requires care. The sooner you act, the greater your chances of preserving your intimate life, healthy and protected. The second common mistake among men is trying harmful home remedies for the penis. So-called magic recipes, internet tricks, or homemade devices that promise to enlarge or improve performance. The reality is harsh. They only cause damage and regret. I've seen men applying strange liquids like vinegar, oils, or unapproved creams. Others try lengthening techniques like jelqing, which seems harmless, but damages the penile tissue with microfractures. That leaves pain, scars, and even loss of function. There was the case of Don Roberto, 72 years old, who tried an improvised rubber band as a ring on his penis. It got stuck and required urgent care to remove it. He spent days fearing he'd lose normal circulation, a traumatic experience. These home experiments not only don't work, but also cause irreversible damage. The penis has fragile structures that can't tolerate pressure or strong chemicals. What starts as simple curiosity ends up in the hospital. If you want to improve your intimate life, the only safe path is to go to a doctor. Today, there are proven therapies, modern resources, and safe techniques to preserve and even recover penile health, but never with improvisations. That's why you shouldn't risk your penis with home solutions. No internet promise compensates for the pain, embarrassment, and risk of losing what you value most. When in doubt, seek medical guidance. That's how you take care of yourself and ensure real protection. The third mistake that should never be overlooked is neglecting intimate hygiene of the penis. It seems obvious. However, many men, especially those over 60, slack off on that effort. The effect can be painful inflammations, bad odors, and even more serious problems. Uncircumcised men need even more care. The foreskin must always be retracted during showers to clean the area properly. If that doesn't happen, residue from secretions builds up and creates an ideal environment for infections and irritations. I've already treated cases of men who suffered from chronic balanitis, ongoing inflammation caused precisely by lack of hygiene. The pain, redness, and difficulty even urinating turn something simple into a serious complication, all because of not taking care of the basics. Another important point: abusing strong soaps or scented lotions also causes damage. The skin of the penis is delicate, and overly aggressive cleaning can lead to irritation or small wounds. The balance is in keeping it clean without overdoing it with chemicals. Proper penile hygiene isn't just about comfort, it's also prevention against infections and even against some rare types of cancer. A simple daily habit can save your intimate life and spare you invasive therapies in the future. So never abandon this basic practice. Keep your penis clean, dry, and protected every day. It's an act of respect for your body and a guarantee that you'll preserve your intimate health for much longer. The fourth serious mistake is not addressing pains or strange signals in the penis. Many men notice discomforts, spots, sores, or even bleeding, but they choose to pretend nothing's happening. That denial can cost you dearly. What starts small can end up irreversible. One of the most dangerous alerts is the presence of blood in the urine. It can mean anything from kidney stones to serious diseases like bladder cancer. Sores that don't heal are also a cause for alarm, as they sometimes reveal silent tumors. I remember Don Anselmo, 70 years old, with an ulcer on his penis. Out of embarrassment, he delayed seeking care for months. When he finally came to the office, the diagnosis was advanced cancer. That delay cost him part of his quality of life. I know it's not easy to show that area to a doctor. Many men feel embarrassed or afraid of being judged. But understand, a specialist isn't there to criticize, but to save you. The discomfort lasts moments, but it can spare you years of suffering. Denying signals doesn't make the problem disappear. On the contrary, it worsens every day. If you delay the diagnosis, treatment options decrease and risks increase. Sometimes what could be resolved with a simple procedure ends up requiring complex surgery. That's why the warning is clear. Never ignore pains, wounds, or bleeding in your penis. If you notice something unusual, seek help immediately. It's better to hear that nothing's wrong than to discover too late what could have been treated in time. The fifth common mistake among men is forgetting to use a condom during intimacy. The false sense of security after 60 makes many believe they no longer need protection. But that decision opens the door to infections and serious consequences. Sexually transmitted diseases don't discriminate by age. Syphilis, HIV, gonorrhea, and HPV still affect older men, often without clear symptoms. When they do appear, the condition may already be advanced and bring permanent repercussions for intimate health. In the office, I've treated men who trusted unprotected relationships and received painful diagnoses. Several of them now carry consequences they could have avoided with the simple, consistent use of a condom. Another important aspect is the risk of penile fractures during intense encounters. When an erect penis suffers a sudden bend, it causes a painful rupture that requires immediate surgery. Half of those who ignore that urgency end up with permanent dysfunction. That's why maintaining control is essential. Choose safe positions, use proper lubricants, and stay calm in moments of passion. Haste and recklessness turn pleasure into a hospital emergency. Safe sex not only prevents infections but also protects your penis. It's a simple care that safeguards your intimacy and your future health. Never neglect this detail. The sixth frequent mistake is exposing the testicles to excessive heat. It may seem insignificant, but prolonged exposure damages not only fertility, but also vital hormone production. Prolonged hot tub sessions, frequent saunas, uncontrolled heating pads, and even resting a laptop on your lap are silent enemies. Over time, that heat reduces sperm quality and testicular vitality. I've had patients confused by low energy, low mood, and declining intimate health. Upon investigation, we saw that their routine included long hours of intense heat in the genital area. Simple habits were destroying their energy. It's vital to remember that the testicles are located outside the body to stay cool. That condition ensures proper hormone and sperm production. Disrupting that balance is playing with a delicate system. Another mistake is carrying your cell phone in the front pocket. Besides heat, there's radiation that, though minimal, can affect you over the years. It's an easy habit to change, and it makes a big difference. That's why you should avoid unnecessary heat. Wear light clothing, put the laptop on a table, and limit saunas and hot tubs. They're small cares, but they protect your penis and your vital energy. The seventh mistake is being too aggressive with the penis, especially during masturbation. When force exceeds natural limits, it may seem pleasurable, but it leaves traces that damage you in the future. A clear example is the so-called death grip. The body gets used to such strong stimuli that no real relationship can match it. The result is progressive loss of sensitivity and difficulty enjoying with a partner. I've treated men who said they couldn't satisfy themselves even with desire. The problem was in the aggressive habit, not the partner. That silent habit erodes intimate life little by little. Another risk is the appearance of microlesions. With each brusque movement, the erectile tissue can suffer internal damage that ends in scars. These reduce elasticity, make erections harder, and generate frustration. The penis isn't made to withstand extreme forces. It responds well to natural stimuli, similar to those in a healthy relationship. The more you respect your limits, the greater the chance of preserving vitality and pleasure for years. That's why you should be gentle with your penis. Use lubrication, avoid roughness, and remember, pleasure doesn't need pain or excessive force. Treating your body with care ensures it stays firm and healthy in the long term. The eighth mistake that compromises intimate health is maintaining harmful habits like smoking, excessive drinking, or not exercising. These behaviors slowly corrode health and strike directly at vitality. Tobacco, for example, is one of the worst enemies. It damages blood vessels, reduces oxygen, and accelerates artery aging. Over the years, circulation weakens, and the penis is one of the first to suffer that destruction. I treated men like Don Claudio, 66 years old, a smoker since his youth. He didn't understand his fatigue and the decline in his intimate life. After tests, we saw his arteries were damaged, and tobacco was the hidden culprit. Excess alcohol also takes its toll. An overburdened liver alters hormone metabolism and weakens the body. The result is a slower, less strong body and a penis that no longer responds the same way. All of that stems from repeated habits over the years. Lack of exercise completes the circle. An inactive body accumulates fat, loses energy, and suffers from chronic inflammation. The sedentary man not only ages faster, but also puts all aspects of his health at risk, including his intimate life. Therefore, if you want to protect your penis, also take care of your lifestyle. Quit tobacco, limit alcohol, and incorporate physical activity into your day. It's a constant investment that protects not only your intimacy, but also your heart, your hormones, and your longevity. The ninth mistake that silently destroys men's health is demanding too much from yourself. Many carry guilt, shame, and anxiety when they notice changes in their body. That psychological pressure is a strong enemy that hits intimate life hard. The mind and body are deeply connected. When a man lives in a cycle of tension and worry, anxiety grows and symptoms worsen. The fear of failure becomes reality, creating a hard-to-break cycle. I've accompanied men like Don Joaquin, 70 years old, who thought he was losing his masculinity. He demanded so much of himself that every intimate attempt ended in frustration. Finally, we understood it wasn't a physical problem but an emotional one. That excess demand generates chronic stress, and stress disrupts sleep, hormones, circulation, and even daily energy. Little by little, overall health collapses, and the penis reflects that wear. What many ignore is that all men go through stages where the body doesn't respond the same way. It doesn't mean failure, but a need for adjustments. Being hard on yourself only accelerates problems. That's why you should be kinder to yourself. Accept that there are good days, and others that aren't so great. Seek balance, and don't mentally punish yourself. Caring for your mind is also caring for your penis. A man at peace with himself has greater chances of living with health and pleasure. The 10th mistake, the most serious one, is completely stopping the use of the penis. Many men after 60 and during andropause think they no longer need to worry about intimacy. That silent decision accelerates wear and brings consequences that could be avoided. The penis was made to be used. Nocturnal erections, for example, serve the vital function of oxygenating tissues and maintaining elasticity. When those decrease, and the man also stops stimulating himself, the result is atrophy, scarring, and shortening. I've seen men who, after years of inactivity, notice changes in shape and rigidity. One of them, Don Armando, 74 years old, thought it was age, but we saw that neglect had accelerated the loss of vitality. Intimacy isn't just sex. It's also contact, closeness, and care. By removing that from your life, the body understands it no longer needs that function and shuts down essential mechanisms. It's true that the frequency won't be the same as at 20 or 30, but maintaining activity alone or with your partner is key to male health. The penis requires movement and stimulation to stay healthy. That's why you shouldn't abandon it. Use it, care for it, and keep up frequent stimulation. That simple attitude prevents atrophy, preserves vitality, and strengthens both body and mind. Whoever stays active lives longer, better, and with confidence. Now you know the 10 mistakes that a man over 60 must avoid with his penis. Each one seems small, but together they gradually deteriorate intimate health. Ignoring these truths is giving up what keeps your masculinity alive. If you truly value the health of your penis, act from today. Don't wait for problems to arrive. Prevention is always easier, less painful, and much more effective than late treatment. Remember, the penis reflects your overall health. Taking care of it means taking care of your heart, your hormones, your circulation, and even your mind. Whoever respects their body gains years of quality life and confidence. Don't fall into thinking that aging means giving up intimacy. On the contrary, in this stage, more than ever, you must stay alert. Every decision today shapes the future of your health and how you'll live the coming years. Be firm, responsible, and never ignore your body's signals. The penis isn't just a symbol of virility, it's a health marker, and it will only function well if you give it the necessary attention. I'm Dr. Silvia Morales, urologist, and my mission is to guide men like you to live longer and better. If this video was useful to you, share it with your friends and subscribe to the channel. Taking care of intimate health isn't a luxury, it's a necessity, and the time to act is now.